This video will outline how to enter 6-month assessment data for records that have not yet been transferred to your team. In some cases, the community or hospital team who were last treating the patient may not have yet finished entering their data when the time comes to add the 6-month assessment data to the record. For these cases, the record will not be locked to discharge by the previous hospital or community team because the team are still entering their data. You can still enter and save your 6-month assessment data, you just can't transfer the record because once the record has been transferred to your team, the previous team will no longer have access, so wouldn't be able to add their data. You can search for these records in the 6-month assessment tool. Go to Clinical, then 6-month assessment, then click Enter and Transfer Records. Select the team performing the 6-month assessment in the first drop-down box. Select Search for patient ready for 6-month assessment. Then select the last team to treat the patient in the second drop-down box. You will then need to enter the patient's audit or SNAP ID number and their NHS number. If one of these is not known, check the Not Known box, and you will be asked to give extra information in question 3. You will need to fill in one of 3A, B, or C. In this case, we know the patient's NHS number. Click Search, and the record should appear below. As you can see, the record has not yet been locked to discharge by the previous team. We can still enter our 6-month assessment details by clicking Enter 6-month details. You can enter your data here and click Save at any time using the Save button on the side. You can use the coloured progress bar at the top of the record to see how far along the previous team are in entering their data. You can see in the progress bar that sections 1, 2, and 3 are green, indicating that the data is complete. Sections 4 and 6 are orange, showing that the data is incomplete, and sections 5, 7, and 8 are dark blue, showing that data hasn't yet been added by the previous team. Once the previous team have completed their data, these sections will turn green, and once they have locked the record to discharge, you will be able to complete the transfer of the record to your team. Your team can only lock the record to 6 months once the transfer has been completed. You can find patients who you've entered 6-month assessment data for and who are ready to be transferred to your team by clicking List 6-month assessments already entered. This will bring up a list of patients whose 6-month assessment data you have already added. For the records that have not yet been locked to discharge by the previous team, you will only have the option to edit the record. However, once the previous team has locked the record to discharge, the option to transfer the record to your team will appear. Click Transfer to complete the transfer of the record to your team. Once the record has been transferred to your team, you can view the record in Clinical Case Management by going to Clinical and then clicking Patient Records. You'll need to select the 6-month assessment provider team in the first drop-down box. The records that have been transferred to your team should appear below. We can edit the record by clicking Edit in the Actions drop-down box. We can view our 6-month assessment data in Section 8. After checking that the data is complete, we can lock the record to 6 months by clicking the Lock button at the top of the record. This record has now been locked to 6 months. We can exit the record by clicking the Exit button on the side. As you can see, the record has been locked to All. Only records that have been locked to 6 months will be submitted to SNAP for data analysis. If you have any questions about the processes outlined in this video, please contact the SNAP Help Desk. Our contact information is in the top right-hand corner of the website. Please note, the patient information in the record transferred in this video was randomly generated and was not from a real patient.